couple of weeks ago was the 6th anniversary of President Obama's unpopular health care law. Just like every year at this time, that birthday is not one that people actually want to celebrate. When you take a look at the reason that Americans aren't celebrating Obamacare's 6th birthday is because it's pretty obvious. Less freedom, unsecured data through the website, fewer provider choices, offering $1 trillion in new taxes, over $1 trillion in new taxes on American families, 2 million jobs worth of hours lost, and skyrocketing premiums and deductibles. So it's no surprise that the health care law continues to be very unpopular. Americans know that they, under the health care law, have less freedom to keep their doctor, to keep the insurance that they had that was right for them and their families, because the president says he gets to decide what somebody needs for themselves and the family, not the families getting to decide. We know, again, it came out over the break, that people's personal data is not secure at healthcare.gov that they thought it was with the website. We know that insurance companies are continuing to give patients fewer choices by limiting the networks of doctors that people can see. The health care law has added over $1 trillion in new taxes onto hardworking American families. The premiums and deductibles are up, and according to the Congressional Budget Office, Obamacare is going to cut the number of hours that Americans can work by about 2 million jobs over the next decade. So it seems like every day there's more news coming out about how this health care law is unaffordable, it's unpopular, and it's unworkable. Last week, there was a new study that explained one of the reasons why the president's health care law is collapsing. It was a study that came out from Blue Cross Blue Shield. It compared people buying new insurance coverage through the Obamacare exchanges to people who already had health insurance through their jobs. The study found that the new Obamacare customers went to the doctor 26% more often than other people did, found that they were admitted to the hospital almost twice as often, that Obamacare customers have higher costs, and that the average medical spending is about $1,200 a year higher for people on Obamacare than people who get their insurance through work. So why is it that hospital admissions are up so much for people on Obamacare? Why is it doctor's visits are up 26%? Is because the new Obamacare enrollees tend to be sicker and costlier. So insurance companies, of course, have to raise their premiums. So people are sicker who are signing up. They go to the doctor more. The insurance company turns around and it raises premiums on everyone else. And that's why so many people are opposed to the health care law, because the impact it's had on them personally. So when insurance companies have to raise their rates on Obamacare plans, a lot of money is paid by hardworking taxpayers, because it's the taxpayers who are paying for the subsidies on all of these folks who have signed up for Obamacare. And what we know is that taxpayers are subsidizing the premiums of 83% of the people who buy Obamacare insurance. So when the premiums go up, taxes have to be made up to pay for it. Well, companies can't get enough extra money. They just stop offering policies in Obamacare. That may happen. And more people will then lose their insurance coverage. Maybe some of the companies will just go out of business. Familiar with that process because we've seen it. We've seen under the Obamacare health care law, a majority of the Obamacare health insurance co-ops have actually gone bankrupt. The health care law created 23 co-ops, and of them, 12 have already gone out of business. Premiums were already out of control, and it's getting worse. The average premium for what's called the benchmark silver plan in the Obamacare exchange is more than 7% higher this year than last year. For people who can only afford this cheaper bronze plan, premiums are up 13% compared to last year. And over the next couple of months, insurance companies are going to start setting their rates for 2017, and they're going to take into account what has happened in the previous year. So this new study by Blue Cross Blue Shield is just laying the groundwork for even more price increases to come next year. And I think this is one of the things that explains why so many people dislike Obamacare. A new poll came out that found that 47% of Americans have an unfavorable view of the health care law. As the Kaiser Family Foundation report shows, America's opinion of Obamacare is tilting negative. 47% unpopular March of 2016 today. A year ago, this poll said that 42% of the people had an unfavorable view. So there we were a year ago, here we are now. The number keeps climbing. Now, only 41% of the people have a favorable view of the health care law. It wasn't supposed to be this way. 6 years ago, Democrats in Washington were very confident that the law would be extremely popular today. As a matter of fact, Senator Chuck Schumer from New York went on Meet the Press. Went on Meet the Press back in 2010, and he said, it's going to become more popular. He said, I predict that by November, those who voted for the health care law, he said, will find it an asset. Well, we all remember what happened in the 2010 elections. We all know that Democrats who voted for the health care law did not find it an asset. Democrats lost 6 seats in the Senate that year, and they lost control of the House of Representatives. Nancy Pelosi was out as Speaker of the House, and the Republicans took the majority. Then in 2013, Senator Harry Reid was making the same predictions about how popular the health care law was going to be. He told the newspaper The Hill here in Washington that Obamacare would be, he said, a net positive for Democrats in 2014. Senator Reid forced the health care law through Congress when he was the majority leader. And I think that's a big part of why he is now the minority leader. He lost the majority in the United States Senate. Why? I think in big part because of the health care law and the fact that it ignored the needs of the American people. The longer people have to live with this offensive and expensive law, the less popular it gets. You know, it was never popular to begin with, but today, even more than before, opinion is, as it says, tilting negative. The new poll also found something I found amazing. I practiced medicine for 25 years, and I've been involved here in the Senate for a number of years. I have never seen anything like this. This new poll found that 28% of Americans say this health care law has directly hurt them and their family. The president says, defend and be proud of this law. How can you defend and be proud of something that 28% of the American public tell you has hurt them and their family personally? Only 18% of the people in the poll said the law has directly helped them. It's incredible and it's disturbing. Obamacare is hurting far more people than it's helping. Costs are going up much faster than Democrats promised, as are copays, as are deductibles. It's no wonder the law is so unpopular. We know that these rising premiums make the law more expensive for taxpayers, but how much more expensive? Well, the Congressional Budget Office came out with a report last week. It said that over the next 10 years, the health care law is going to cost $136 billion more than they thought it would cost just a year ago. Just a year ago. When they compared what they thought it was going to cost a year ago, what they think it's going to cost now, $136 billion more. That's despite there actually being fewer people in the insurance exchanges than they expected. They predicted there would be 21 million people buying Obamacare insurance this year. Well, in fact, they say it's going to be no more than 12 million. People are doing everything they can to avoid these insurance policies, especially young, healthy people. So why is it going to cost an extra $136 billion? Well, one of the reasons is higher premiums, sicker patients, and another big reason is because the law has dumped so many more people into Medicaid. About 23% of the people of the country under the age of 65 are now on Medicaid. That's what the Congressional Budget Office says, 1 out of every 4. So is that a success, putting all these additional people on Medicaid? The president says it is. Well, let me tell you, as a doctor who's practiced medicine, taking care of patients for 25 years, putting millions of additional people onto Medicaid is not success. It's not what people wanted. It's certainly not what President Obama promised. Americans deserve better. They deserve better than to be shoved into this second-tier health care system. Plus, In terms of government programs and wasting money, a recent study found that of every dollar spent on Medicaid, people only get about 20 cents to 40 cents of benefits on every dollar spent. How's that for an inefficient government system? Mr. President, almost every day we get more bad news about the damage that the health care law is doing to families across the country. Republicans have offered solutions that would actually keep the promises that Democrats made for Obamacare. Things like letting people keep their doctors, keep their insurance, things like giving people more options for how they could reduce the cost of their medical care. Americans have now been forced to try this Obamacare experiment, what the Democrats wanted, forced to do it for the last 6 years. Obamacare isn't getting any better. It's just getting older, and it's still making things worse for American families. That's why it's so unpopular. Thank you, Mr. President. I yield the floor.